to our clinic at Tacoma Health. I'm here with our wonderful office assistant, Ellie Reed, and this is our humble abode. We want to show you inside and show you a little bit about what we do. Come on in. This is something very specific that is done in very few naturopathic offices across the country. Maybe we're only one of about 5. What we do is we take a urine and saliva sample of every patient. And what that allows us to do is identify exactly the perfect program for that patient. We're going to be checking factors that you may have heard of, such as pH, how acid or how alkaline your urine is. We're going to check conductivity. What's your electrolyte level? Do you have too high of electrolytes, or your electrolytes too low? That can dispose you to cardiovascular conditions, or it might dispose you to glandular insufficiency if your electrolytes are too low. We're going to look for your protein levels. Are they too high or too low? That can often tell us about hormone, or if your wastes are too high, if you're more of a susceptibility for needing cleansing. That's where I started the foundation of this book. Dr. Ken Meadows was taught by Dr. Reams, who was an associate of Albert Einstein's, and what they did is they understood the equation E equals mc squared, where food has to be turned into energy, and it's actually the energy you live off, not the food itself. So this book is a compilation of all of our experience, my experience in the clinic for 20 years, my teacher's experience for 30 years, and his teacher's experience beyond that. It's really looking at what nature does that we have failed to follow after thousands of years. We've really fallen away from what the premise of living naturally is about. This is what we've built our foundation upon, along with our chemistry. What are common questions that patients ask about regarding what we do with this?
How does it give you an idea of what's going on in their body?
Okay, so for a perfect example, let's say somebody comes in with a urinary pH around 7.5. Ideally, we want their urinary pH to be around 6.4. Now, that may not seem like far, 1.1 degrees difference, but in a logarithmic scale, as far as pH is concerned, that's 10 times too alkaline, which means that they're actually not making enough hydrochloric acid. Now, if you're not making enough hydrochloric acid, then you can't break down your food, particularly the protein. If you don't break down your protein, then that protein can't turn into amino acids, which means it can't be reformed into forms of hormones or other aspects regarding tissue repair or even enzymes. All of your enzymes are made with amino acids. So that one simple number tells us a lot. If you're too acidic, then you're going to be really high in inflammation. What does acid do? It burns. If you put acid on the skin, for example, this sulfuric acid is going to burn a hole right into your skin. Just think what happens when we get too high of acid inside of our digestive system or inside of our urinary system. So that one number, urinary pH, can tell us a lot, but that's one of about 45 different values that we check.
Now, Dr. Iverson, another question that we receive is, can we share this with family members? Our plan that we receive from you.
No, every single person's an individual. For example, your husband might come in with high salts and you might come in with low salts, so we might need to give you electrolytes, we might need to take electrolytes away from him, or increase his water intake, or decrease your water intake. That means that not every person is going to have the exact amount of water necessary. You might hear, take half of your water in ounces. That's a generalization. But in some people, we actually give them more, or we give them less. Every person is different. And that's what's so unique about this test. So we get even more unique. Come on back. Let's show you what else we do here. So this is our main treatment room. And what we do here is a system of testing, which you're familiar with now. First of all, we like to do an intake. And I think that's probably one of the most important parts of your appointment, is to actually hear what's going on with you. There can be more shared in that doctor-patient interaction than any other aspect of what I'm finding. Of course, the chemistry is paramountly important, but what you share with me is so important to identify the true meaning behind where this condition could have started. Every aspect of life is a frequency or a vibration. So this is called our visible light vibration. This is red, orange, yellow, green, blue, purple, ultraviolet. And we use these to accentuate aspects of the frequencies in the body that may be missing. For example, if our body is missing a long wavelength, such as red, we can find that by what's called reflex testing. And some people actually need to wear more red. Some people need more magnet therapy, which is positive and negative. Our body is, each and every cell is a magnet upon itself. But there are times when we might need to recharge a specific aspect of the body. We do this with placing it over a particular reflex point. It could be a heart reflex, could be a thyroid reflex, could be a liver reflex. Of course, you'll see blocks here. We also do manipulation. Sometimes we just need to adjust the bones, help the muscles and the alignment of the tendons. Over here we have some kits. Now these kits are quite neat because inside of them, as we were just talking about frequency, is the frequency of many different types of foods and many different types of microorganisms. We put these on the body and we can actually get an identification if they're resonating or not. For example, if your body's resonating with one of these bacterial vials, then we want to look a little more closely and see if there could be an underlying chronic, quiet bacterial infection that you didn't even know about. So we work with these to identify what types of specific foods, what types of bacterial imbalances, what types of possible chemical interventions could be interfering in the body. We have all these heavy metals, we have radiation as far as frequencies, we have different environmental toxins, which the list is long, everything from medications to cleaning agents. We also use gem therapy. We have to realize that not just food that we put into our mouth can carry a frequency, but just merely holding on to certain elements, because these are minerals too, can affect the physical body. We may also work with sound therapy. Sound therapy is carrying a specific wavelength through the body, and we put these on specific points depending upon what we are trying to use. We can use them for allergy desensitization, we can use them for immunological charging. That's another aspect. We also work with homeopathy, Bach flowers, and essential oils, which are some of our favorites. The essential oil kit, we choose from approximately 35 different remedies here and find the exact remedy that your body is needing. This is all vibrational medicine. This is working on levels that are beyond food. So food is our foundation, what we just saw. Beyond that food foundation, everything that comes in has to come out. So it's not just about what you eat, it's about how well you're eliminating it. That's why we're also big on cleansing, detoxification, getting rid of these things properly, eating well, fasting, and helping the body to alleviate that which is trying to get rid of. So that's just in a nutshell. Do we have any questions on this, Ellie? I know it's kind of complicated.
How do we use the essential oils in our therapy? That's the question we often get.
As far as what particular aspects of the body we might use them for?
Absolutely.
Okay, so let's just say somebody is coming in for a digestive disturbance, all right? And we work on their diet, and we also work with giving maybe a supplementation that is specific to them. But then we ask the body, is there anything else that it needs? And it says, I'm still not complete. I haven't completely balanced out all of my meridians. And so we ask, well, what else could you possibly need, body? And sometimes it says, I want homeopathy, which is a vibrational medicine. But sometimes it says it wants essential oils. We have to understand that these oils, these volatile components, which we smell in plants, are one of the most important agents for healing. They have been for thousands of years. And just imagine what it smells like when we smell a rose and we're almost healed by this, the fragrance of a flower. So there's definitely a neurological component to smelling it. It works on our cranial nervous system. So when we make a specific essential oil, we apply it to the feet, we apply it to the hands, and we apply it to the ears where all these reflex points are, thereby assisting these organs where they may have needed assistance.
I can't use the same supplements that my family member uses. And how do we help our patients best understand that?
The most important way is to have every person in the family come get tested individually. However, that's not always possible for people. So if there's some advice that we can pass on that is not going to be challenging for any particular body type, it goes right back to Old Faithful, everyone. There's a reason why I wrote the book, is because it needed to be written. And with that comes the cookbook, because it needed to also have a manual on how to put this to use. So as far as our individual supplements, no, we don't share those with our family members, but dietetically, every person can find how to eat more proper if they started to read this and utilize it and actually put it to practice. Well, thank you for this little impromptu celebration of Tacoma Health. And we look forward for you coming in and seeing us in person.